Hello everyone, welcome back to my YouTube channel. Today we are going to discuss about wrist joint. Wrist joint is a synovial condyloid joint. The articulations are inferior surface of the lower end of the radius. This is the radius, this is the ulna. So inferior surface of the lower end of the radius and articular disc of the distal radio-ulnar joint. This is the distal radio-ulnar joint. The articular disc of the distal radio-ulnar joint also involved in formation of this wrist joint. Inferior surface of the radius and proximal surfaces of the scaphoid bone, then lunate bone, this is the lunate bone, and triquetrum, this is the triquetrum, scaphoid, lunate, triquetrum. Their proximal surfaces and inferior surface of radius and articular disc of the distal radio-ulnar joint are involved in formation of wrist joint. Here, the capsule is attached above to the lower end of the radius and ulna. Above means proximally. Capsule is attached proximally to the lower end of radius and ulna. Proximally to the radius and ulna and below to the proximal row of the carpal bones. Below to the proximal row of the carpal bones. I'll show it in another picture. In this picture also you can see the capsular attachments of the wrist joint. Proximal attachments to the lower end of the radius and ulna and distal attachments to the proximal row of the carpal bones. As in every joint, this joint also has a synovial membrane which lines inner surface of the articular capsule. But remember, this synovial membrane does not communicate with the cavities of distal radio-ulnar joint and intercarpal joints. As you can see in this picture, there are several ligaments which strengthen this fibrous capsule. They are radial collateral ligament, then palmar ulnocarpal ligament, palmar radio-ulnar ligament, then palmar, this is also the palmar radiocarpal ligament. Those are the ligaments which strengthen the capsule of the wrist joint. In this picture, you can see the blood supply around the wrist joint. Ulnar artery and radial artery gives off carpal branches to these carpal bones, and also they blood supply to the wrist joint. Then the movements of the wrist joint. This is flexion of the wrist joint, extension of the wrist joint, radial deviation, ulnar deviation, pronation and supination. Flexion of the wrist joint is done by all the long muscles which crosses the wrist anteriorly. All the long muscles of the wrist which crosses anteriorly. Extension is done by all the muscles, extensor muscles which crosses posteriorly. You have to remember that in the wrist joint, it cannot be rotated because this joint is also a synovial condyloid joint. Rotation is not possible in synovial condyloid joints. That's why rotation of the wrist cannot be done. So that is a simple explanation about the wrist joint. Thank you for watching.